All right. Good evening, everyone. Thank you for joining us this evening to learn more about the monkeypox virus and steps you can take to prevent the transmission of the disease. My name is Jessica Gonzalez, and I currently serve as a state representative for House District 104. I know Cliff, Dallas, Grand Prairie, Cockrell Hill. I also serve as vice chair of the House LGBTQ caucus. We were joined here today with a panel of state, city, and county leaders, all determined to take action to prevent the spread of monkeypox in our community and work towards increasing vaccine capabilities. We'll be hearing today from Dallas Deputy Mayor Pro Tem Omar Narvaez, Dallas County Judge Clay Jenkins, Dr. Philip Wong of Dallas County Health and Human Services, Dr. Roberto de la Cruz, the Chief Medical Officer at Parkland Hospital, and Dr. Aurelia Smallpox, the Regional Medical Director of the Texas Department of State Health Services, Dallas region, and that's a mouthful, and an infectious disease specialist. We'll be taking questions in the Facebook Live comment section, so if you have any questions, please leave them below. Live Spanish translation is available on Univision's 23 DFW's Facebook page. So according to the CDC, monkeypox is a rare disease caused by infection with the monkeypox virus. The monkeypox virus is part of the same family of viruses as the variola virus, the virus that causes smallpox. Monkeypox symptoms are similar to smallpox symptoms, but milder, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox, for those who may think so. Monkeypox can spread to anyone, no matter your sex, your gender, your race, your socioeconomic background, sexual orientation, or gender identity. As of this afternoon, there are 6,326 monkeypox cases in the United States, with 485 cases here in Texas, the fourth highest in the nation. The Biden administration has put in orders for more vaccines that will be arriving in the coming months. And yesterday, President Biden named Robert Fenton, who is a regional administrator for FEMA, as the White House monkeypox coordinator. So far, Texas has received 15,636 doses of the vaccine, and Houston has received 5,324. Additionally, an allocation of 41,840 doses for Texas and 16,780 doses for Houston was announced at the end of last month and should hopefully be arriving to Texas soon. The doctors on the panel will be elaborating more on monkeypox, how it's spread, what symptoms look like, what to watch out for, vaccine options, and treatment options. But first, I want to turn it over to Dallas Deputy Mayor Pro Tem Omar Narvaez to share some words. Thank you.
Thank you, State Representative Jessica Gonzalez. First, I want to start by thanking you for joining me and working with me to help put this together. And thank you to your staff who really did most of the heavy lifting putting this together. This is a very serious subject. I also want to thank County Judge Clay Jenkins for joining us, as well as the rest of our esteemed panel from Parkland Hospital, as well as Dallas County Health and Human Services and the state of Texas. What we want to start off with is just reiterating what the state representative just said. Anyone can get monkeypox. Anyone can get monkeypox. This is not just a gay man's virus or something that is only spread amongst men who have sex with men. This is a virus that just happened to start in this community, which I'm a member of, and it's something that we need to get under control. So just want to make sure everybody understands, yes, there's a disproportional effect happening right now within the LGBTQ plus community, but at the same time, we're already starting to see transmissions happen to members of the community that are not LGBTQ plus. So we need to make sure that we do not allow anybody to regulate that this is a virus that only affects gay men or men who have sex with men. It's just the disproportionate place that we're at right now. And it's also very important that everybody in Dallas County understand that Dallas County has the most infections of monkeypox right now in the state of Texas. We're not anywhere close to some of the epicenters across the country, but we are the largest in the state of Texas. A lot of that has to do with the amount of population that we have here, as well as earlier in the summer, we had a lot of different events where people were in close contact with each other, dancing at festivals, where there was more skin to skin contact happening. From that, the virus starts to spread. I don't want to go too much into that because I want to make sure that our medical professionals are able to speak on those specifics, because that's what we're here for everybody to get the facts and know the facts here in our county. What I will say is that I am very pleased and happy with what is the response so far that we've had over the last 7 to 10 days, not just from at our county level and our local level, but also at the state level and now at the federal level. All of this, it takes every single one of our different partners in order for us to get this virus under control, very much like we did with COVID. So everybody out there, just please understand and know that we understand that people are nervous, they're scared, that people don't understand. I was that person about 3 or 4 weeks ago who's now understanding and learning more and more. So kind of remind yourself about COVID. This is not transmissible at the speed that COVID was or is. This is a much harder to transmit virus, but it's a long-lasting virus once you seroconvert with it. So just make sure that everybody understands. I want to reiterate that this is not just a virus that affects gay men or men who have sex with men, that this is a virus that can be spread out. We haven't had it in the county, but we have seen it in other parts of the country where it's been transmitted to children already. So we want to be extra careful and precautious while we're out there. Things are coming. We have vaccine on the way, some vaccine that's hit our county and our city that are being given to people, but I'm going to let our medical professionals talk about that and answer your questions. So please, just like State Representative Gonzalez mentioned earlier, if you have any questions, please put them in the chat on Facebook, and we'll get those to you and get to them as soon as we possibly can. Thank you again, everybody. It is my distinct honor and privilege to serve as the Deputy Mayor Pro Tem for the City of Dallas and as the chair of the LGBT Task Force for the City of Dallas. And again, thank you to all of our partners here. This is government working together at all our different layers, which is what you want in order for us to get through this virus that's starting to affect our community. With that, I'm going to turn it over to Dr. Roberto de la Cruz, the medical officer for Parkland Health Hospital. Doctor?
Thank you so much, Representative Narvaez, for the opportunity to speak to you today. I wanted to grab the baton from you, and you were talking a little bit about the medical facts on transmissibility of the monkeypox virus. So I'll talk a little bit about that. First of all, how does it spread? The transmission of the monkeypox virus can be by direct contact with any sore, scab, or bodily fluids of somebody who has active disease. Bodily fluids include saliva, sperm, and at this time, any type of bodily fluid. Interestingly also, contact with bedding or clothing that has had scabs or active fluid from the scabs and the disease can also be aerosolized, and it can, in the air, be transmitted by breathing it. Skin-to-skin contact, touching an area that has an active scab or a sore can also be a source of infection. And I wanted to, again, reemphasize that even airborne disease can be transmitted if somebody has active disease. So in Dallas and in the country, the initial area that seems to be the highest risk of transmissibility is by direct contact and touching of active disease, including in areas of intimate contact, including areas that are in the genital area from having sexual intercourse with people that have active disease. Secondly, I wanted to then talk a little bit about how to prevent infection. And so prevention of infection has to do with avoidance of high risk. So at this time, avoidance of high risk behaviors that have been identified as the initial source of infection, like avoidance of anonymous or multiple sexual partners, but also avoiding skin-to-skin contact with people that are high risk of getting monkeypox is very important. I talked about saliva also. So also saliva can transmit the disease. So you have to be very attentive in who you're being, intimate or kissing, because saliva can also transmit the disease. So anything that can be an exchange of secretions in somebody who has the disease or has a high risk of having monkeypox infection is very important. People have asked about condoms. So theoretically, condoms can decrease the risk of monkeypox infection. But remember, I just said that also you can have scabs in the genital area or anywhere in the skin. And so using a condom will not prevent you from touching areas of high risk. So you have to be very, very cognizant of that. Monkeypox right now has some treatment options. This is a virus that is a cousin of smallpox virus. And then the US has developed medications in case there was a bioterrorist attack with smallpox. So medications that were developed for smallpox are becoming available and are effective against monkeypox. They are medications that are on experimental use, so they're not widely available, and they're becoming available slowly in the areas of disease, including Dallas. These medications have to be dispensed by a medical professional. They have to be dispensed after discussion with the patient and consent with the patient that they're getting a medication that is an emergency use investigational agent. And it's available by oral, by pill form, and by IV form. And there's some specific requirements for patients who would qualify for the medication, including that it has to be a high burden of disease or disease in sensitive and painful areas, including the genital areas, the perianal areas, and in the mouth areas, or in patients that have disease and also are at high risk of having severe infection, such as patients that have immunodeficiency disease, HIV, active cancer, or other illnesses. So the dispensing of the medication requires a consultation by a medical professional. In addition, because the way that we have found the infection, a medical professional will also question and test for other sexually transmitted diseases such as gonorrhea, chlamydia, and syphilis, which are very important for us to identify and treat. A little bit about Parkland. First of all, we're here for the community. We're your public hospital, and we're doing everything possible to stand up testing for monkeypox in some of our clinics, and also developing quickly capacity for vaccination and also medication dispensing. These, as I said, these medicines are a little require medical evaluation, require consenting, and also the vaccines require some documentation. So we're right now rapidly developing that capacity. I wanted to talk a little bit about the stigma that Representative Narvaez said. So medical professionals are here to serve you. And if you have disease in some sensitive areas, please, please, please seek medical attention and don't stay home and be embarrassed by this. There is nothing to be embarrassed about. It's a disease that needs treatment and needs to be eradicated. So please contact your medical professional as soon as you can. And then before I hand it over to the next to Dr. Huang, I wanted to go back to Judge Jenkins, who also wanted to say a few words regarding the county response. So thank you, and Judge.
Certainly. So I'm going to let most of our time be with the medical doctors, but I want to thank everyone for joining us on this Facebook Live. And I want to let you know that monkeypox is a well-known disease. So unlike COVID, where we were learning about COVID and our medical professionals were learning about COVID, and some of the recommendations early on changed with COVID because it was a novel new coronavirus, monkeypox is a well-known disease. And the doctors know what you need to do to prevent spread. They know the hierarchy as we get in these shots of who's most at risk so they can get those shots to the people that are most at risk. Now, we don't have as much vaccine right now as we need to have, and that's not because our state and federal partners are not working very diligently and very hard to make that happen, but there's a nationwide shortage of vaccine. So we're going to be working to get more shots in arms for the people that need it most. And we're going to be expanding that eligibility. That eligibility, Dr. Wong will go through it with you and what our hotline number is. Here, let me just say it 2 or 3 times since I've got it in front of me. From 9 to 5, you can call this number and get information and see if you qualify for a shot. And that number, and I'll say it 3 times slowly, is 972, and hopefully somebody can put this in the chat. It's 972-692-2780. That's 972-692-2780. 692-2780, 972-692-2780. You can go anytime, day or night, to dallascounty.org. That's dallascounty.org for information on monkeypox. And absolutely, there is no stigma in getting monkeypox. It doesn't matter how you got it or who you got it from. If you get it, we want to help you. And if you think you've been exposed, we want to help you. We want to help every resident of this county, every person that comes through here. We care about you. We want to protect you. We want to get you well if you're sick, and you need to call us and let us help you, or let the doctors and the groups that'll be giving shots help you. So with that, I will turn it over to Dr. Huang. Know that Dr. Huang and I, Dr. Dela Cruz, and everyone on this call are working day and night to make sure that we get this outbreak under control and we protect you from monkeypox. Dr. Huang? Oh, Phil, you're on mute.
Sorry. Thank you, Judge, and thank you, State Representative Gonzalez and Mayor Pro Tem Narvaez. Honored to be on this. As the judge was mentioning, we've fortunately do know more about monkeypox than say we did about COVID at the start of this. But our response, we've been, I think we had the first case in Texas. I think June 5th is when that individual was first tested positive. But we've been working very much with our medical community to make sure everyone was thinking about monkeypox, educated about and tuned to what to look for, how to do the tests, how to submit the tests. The lab at Dallas County Health and Human Services has been the primary lab up till recently for doing all of the testing for monkeypox. So we're working with our community physicians on getting those specimens. We were able to turn them around pretty quick, usually sometimes a few hours, but within 24 hours. And now we have more commercial labs that are also offering the testing, but getting also the education about how we prevent it. And vaccine is one of the tools that we have. But we also, as Dr. Dela Cruz mentioned, we know how this is transmitted, and there are things that we can do to try to lessen the risk and prevent transmission. It's not as easily transmitted as COVID. It does take more of that direct contact, skin-to-skin contact, or prolonged face-to-face contact. So that's one thing that makes this response easier to handle than some. But as has been mentioned, the vaccines are one other piece of the response. We are hoping to get more. I think we initially got an allocation of about 120 doses that we ran out of about a week and a half ago. And then early last week, found out that we would be able to get, and the state, I think, was found out, was able to get some shipment. We got about 5,000 doses out of the state's, I think, 14 or 15,000 doses they received. We have been working with, it's still not a lot of doses. 5,000 sounds like a lot, but it's not as much as getting that, given the number of persons that we would like to get vaccinated for prevention. Thus, we've had to initially prioritize the vaccine. We started out with the first doses, just those that had close, intimate skin-to-skin contact with someone who tested positive for monkeypox. With this new shipment, we've been able to increase and make it more available so that those eligible are also men 18 and older who have sex with men, men who had, or men who have sex with men who have multiple or anonymous sex partners in the prior 14 days. Again, those are just some of the highest risk groups at this time. And as Efren has mentioned, anyone can get monkeypox. It's not just men who have sex with men, but because there have been, initially they were sort of overseas events and raves or dance parties where large numbers of men who have sex with men were gathering together and having close skin-to-skin contact. And similarly, as Councilmember Narvaez mentioned, in Dallas over the July 4th weekend, we had a large event here where I think it's been estimated up to 3,000 persons attended those events with close skin-to-skin contact. So that's why at this time we're trying to prioritize that vaccine to those that are at the highest risk. That, again, with it being limited, we need to make sure that every dose does the best that we can, has a maximal impact on trying to slow the spread down in our community. We are also working with many of our community partners on distribution. Now, I know Parkland has had, I think we got 500 doses. I think Parkland is administering primarily to all of their Parkland patients that fit into these eligible categories. We're also working with PRISM, and they've received 300 doses. And I know we're talking about getting them more in the very near future. They, I know, opened up their phone bank to this morning, received a very quick response, and I think filled up their slots, and they're going through those, and then are going to be opening it up again as more appointments are available. We're going to be getting doses with other partners again, like Abounding Prosperity, Community Health Empowerment, or CHE, the Kind Clinic. I believe we'll be receiving some in the short term. And we're also working with some of our partners that once, again, even more vaccine is available to hopefully have more, even larger distribution points, hopefully to expand like what we've been doing at Ellis Davis. But as the judge mentioned, we have our phone banks that are operating 9 to 5 in the weekdays at 972-692-2780. That can help direct and persons to those appointments. Again, understanding right now we still have limited doses, so we're trying to get these shots in arms as quickly as possible. But ideally, also you want to get, if there is an exposure to someone who's had monkeypox. Ideally, you get that vaccine in the arms within 4 days after that exposure. It can still be administered between 4 and 14 days after the exposure, but it does not, not as ideal for preventing infection, but certainly could lessen the severity. Now, one thing, the vaccine is for preventing monkeypox infection. So if someone actually has lesions after exposure, then we don't need to give vaccine anymore. So that, because it's to prevent the monkeypox, but not to treat it. So again, if someone after exposure has developed skin lesions and rash already, then we would not be then giving a vaccine in that case. But we do want to try to get the vaccine to persons who have been exposed or at high risk before any evidence of monkeypox has been demonstrated. So let's see. Again, also testing, we're working with many of the partners. I know Parkland has been providing tests. I think they have some outpatient setting outside of the ER where people have been able to get testing. Some of the other partners, I know PRISM is offering testing. Some of the other hospitals are offering testing. I think referrals from their emergency departments, and trying not to actually use emergency departments in most of the settings, but get people done in outpatient settings. And again, some of the other providers are offering testing and it's now the actual lab processing is being administered through some of the commercial labs in addition to the Dallas County lab. So the testing is more available than previously. But let me stop there, and I think I'm going to be then turning it over to Dr. Aurelia Schmalstig regarding the state response, who's the Regional Medical Director for Department of State Health Services.
Hello, everyone, and thank you for asking me here to participate today. It's a great opportunity to just communicate to everyone that there's a lot of work being done right now to get the resources where they're needed on a local, state, and federal level. My understanding is that there will be more vaccine available towards the end of the month. In my role here in the region, I'm the medical director for the area of North Texas, and that includes Dallas. But if you don't live in a county that has a local health department, we can help provide services. I'm an infectious disease doctor, and I'd be happy to answer any questions as well. Thank you.
Thank you all on the panel. Now we'll move to some of the audience questions that we've been receiving. The first question was, how many vaccines are available in Dallas County? Dr. Wong, you're actually muted.
So right now, as we mentioned, we just received, I think, 5,120 doses at the beginning of the last week. I know we've been working with some of the other partners. Again, I know Parkland has 500, Prism has 300. Let's see. So we have available doses right now. So that's, and we were just talking before, we are not holding back the doses for second doses. So we are trying to get them out for the first shots to everyone who is eligible as quickly as we can. So it's at least probably 4,000 doses at this time.
The next question was, is Parkland the only place to get access to treatment?
So thank you for that question. So all of the hospitals and the medical leaders in Dallas County have been meeting and trying to open access. The medication that is being used for monkeypox is, as I said before, obtained only through direct access through the federal stockpile, and that is being coordinated through the state response and the county health department. So there are multiple sites that have access to the medication, and right now Parkland is one of them. And I'll have Dr. Huang kind of elaborate on that.
Sure, and we've been, it is under this investigational drug sort of access. We've been working with some other private providers. I know the VA hospital has it, Prism, and I think there are some others that are working to get it also. So it is available, and when providers have asked us for that access, when a patient presents that is indicated to receive it, severe lesions, we have been working with them to get that. So it is available. It is a lot of paperwork because of its investigational use, but I think they've been trying to simplify some of that also. But again, there are multiple providers, I think, that are now able to provide the TPOXX.
The next question was from Joseph, if he is able to get the vaccine like he would get the COVID vaccine.
It depends in what way are you, in terms of COVID vaccine, we have much more availability right now. Although if you think back to the early days when it was first released, it was much more limited in availability. So, but we are, again, as I mentioned, some of the criteria that we currently have for the limited availability, so it's not just everyone getting it like you can get with a COVID vaccine now, but we are restricting it to those that are at the highest risk and those that are at the highest priority for preventing further transmission. So again, from that standpoint, it's not like COVID, and the availability is not at the same time at this point as easily available as the COVID vaccine, but we certainly hope with the new, as further shipments come in, that we can make it similar to that.
The next question was, can you describe what suspect cases mean as reported on the Dallas County website? And how does that monitoring process look like?
Sure. At this point, some of the suspect cases are those that have come in. The physical exam or history or is highly likely that it is monkeypox, but that we don't have a confirmed test result on those persons yet. And I'm sorry, what was the second part of the question?
What does the monitoring process look like?
Okay, the monitoring. So early on, we were calling all of the persons who were close contacts of confirmed positives on the phone. At least, actually, I think initially we were doing twice a day to monitor. They were to monitor for fever and for any development of symptoms or rash for 21 days, because again, one of the other things is if someone is exposed, has that close contact to someone who has tested positive, they should also monitor for 21 days. And if they develop any symptoms, then immediately contact their healthcare provider and go for testing if there are lesions. So we were doing some of that active monitoring. We have been still, I think we've reduced the actual phone calls now to 1 per day, and we have now implemented some of the automated text messaging now for those persons under monitoring, those with a text message once a day, and they'll link to a survey that then they can complete and report their temperature and any symptoms. So that's continuing to evolve, especially as the numbers of contacts that are needing to be monitored and the numbers of cases have gone up. So it's definitely taxed a lot of the manpower for some of the staff. So we have just now implemented some of the automated monitoring.
The next question was, does the smallpox vaccine I got in 1971 protect me at all?
I can start, or I don't know if Dr. Dela Cruz wants to answer that one.
Yeah, I can jump in. So unknown, because it is unknown if a vaccine that you obtained decades ago still has effectiveness. And so right now we don't have the science to be able to say that. Theoretically, you should have some protection, but we are unable to say that you're fully protected from a prior smallpox vaccine.
The next question was, yesterday at the commissioner court, several commissioners suggested shutting down gay establishments in order to combat monkeypox. Does the county intend to pursue these actions?
This is Judge Jenkins. No, we don't. We were going to get information out as to how best to protect yourself from monkeypox, but that sort of a thing would only exacerbate people feeling this whole BS deal about how somehow this is a men having sex with men only disease. It's not. Anybody can get monkeypox. Anybody can spread monkeypox. Gay establishments are responsible corporate citizens. They're not going to do stupid things, and the people that go there aren't going to do stupid things, and we're going to get them the information, and then they're going to do a good job. So that's not going to happen.
The next question was, how does the vaccine work, and how long do we wait for the second dose?
I can jump in. And so it's Dr. De La Cruz. So what vaccines do is that they give you a signal that makes your body create an immune response against the signal. And the signal that the vaccine is giving you is similar to a protein located in the virus. And so your body, in a sense, gets prepped up and is able to fight the virus if it encounters it, and so it helps you against the disease. That's how all vaccines work. This vaccine has to have a follow-up within 21 days, and so after getting the first dose of the vaccine, you will get an appointment for a second dose. As Dr. Juan said, if you have active infection, or after getting the vaccine, you develop active infection because you haven't developed full immunity, full effect of the vaccine until a few weeks after your second dose. So if you have had an exposure, it is theoretically possible that you still develop the infection. If that happens, then the second dose of the vaccine is not necessary, and you will need to be monitoring yourself for symptoms with your physician.
The next question was, what happens if a child gets exposed or gets the virus? Are there vaccines available for pediatric use?
Maybe I can speak briefly to this. The Jynneos vaccine, if it were given to an individual less than 18, there would be some additional processes that would need to be followed, and the caregiver would need to sign additional consents. There would be a slightly different process for someone younger than 18 years.
With school starting soon, is there a possible plan of action in the works?
We certainly work very closely with the schools and education. We work with the school nurses. We certainly want to make sure that the schools know about monkeypox. Again, similarly, what we talked about earlier in this, making sure everyone is aware of how it's spread, what they look like, but to have that awareness. Also, if there were to be any cases in either staff or students, we work with the schools always on perhaps and for this contact tracing, identifying any other students or others that might have been in close contact, and then we would certainly want to follow up with appropriate measures.
If I can say that it's really important to do this contact tracing. And so, for example, even now, if you are a patient with monkeypox, it's really essential to actually think through and provide information as accurately as possible as to who could possibly have been in contact with you during the infected period of time, so that we can try to prevent the infection from continuing to spread. So that open discussion and honest discussion is really essential for infectious diseases and for epidemics.
The next question was, working at a clinic, if we have a patient with suspected case or a positive case of monkeypox, who do we report it to, or would the lab report it?
So we do get the lab reports of the positive tests, but also the clinician can report it to the health department, to our epi group.
The next question was, how many people are on the waiting list as of today?
Oh, I don't know exactly at this moment. I do know, I did hear also from Prism when they opened up their phone lines, they had a very robust response, but I don't know the exact numbers that are on the waiting list at this point.
The next question was, are there any adverse reactions to the vaccine? And if it was cleared by the FDA?
Pertaining adverse reactions, there are some similar adverse reactions to all vaccines, and these seem to be local in nature. So warmth and redness in the area of vaccination, some fatigue and discomfort, just like with other vaccines. Importantly to understand that this vaccine has not been widely given to thousands and thousands of people. So, so the vaccine requires also some information to be provided to the patient, and also some monitoring and reporting if any patient with a vaccine has additional symptoms. And I'll defer to Dr. Smallpox to talk about the details about the approval of the vaccine and the status.
Yes, Dr. De La Cruz, we don't have a lot of real world data using Jynneos. Just earlier this year, it was approved as an alternative to the older sort of vaccine that is similar to ACAM 2000, that is actually a little bit, it really can cause some pain, and there can be some other reasons why someone wouldn't be able to get ACAM 2000. So Jynneos was just recently approved to be given to people who work in laboratories, for instance, doing smallpox or monkeypox testing, but again has not been given to thousands and thousands of people. So we don't know as much about this vaccine, for instance, as we did when we were administering COVID vaccines. But it is true that it has a much more tolerable profile than the older types of vaccines that were being used for smallpox. And really the only contraindication to getting a Jynneos vaccine is if you had a serious allergic response to the Jynneos vaccine in the past.
Thank you. The next question was, this person has already had monkeypox and they're wondering if they would be able to catch it again.
I will say that again, there is not a lot of real life experience with the illness. Medically, it is unlikely that you would catch it again in the immediate period after having any infection. Your body revs up your immune system, and usually then that is enough to prevent, a secondary infection. But right now, we don't have a lot of real world experience, and I would not be able to say with any specific confidence if a person who has had monkeypox is immune and for what period of time after having the infection.
The next question was, are there antibody tests available to confirm if someone's had it in the past?
So currently there are no antibody tests available. The only test available for confirmation of monkeypox virus are local scrapings and swabs of wounds. And so this is also limiting our ability to provide information in terms of immunity.
The next question was, is the vaccine administration being tracked in MU-Track, or is there any sort of ID card similar to the COVID-19 vaccination that individuals can keep and share with their primary care physician?
I don't know if Dr. Schmalstick wants to talk about MTRAC, but it is all of the doses are being reported in MTRAC, and I believe, and I'm sure we give a record of that vaccination to the individuals.
But there's not a card that's given out, as far as I'm aware, similar to the COVID vaccine cards.
The next question was if the vaccine interferes with any other medications.
Again, I will say that it is medically unlikely that the vaccine would interfere with other medications, but it is a vaccine that we don't have a lot of real life experience. The FDA is going to provide some updated information pertaining co-vaccination with the monkeypox vaccine and other vaccines. Usually, those are spaced apart by a few weeks. And that information has not been clarified yet, but there is no active information about contraindication of the vaccine because of medication usage. It is very unlikely that that is the case, and that is currently not a contraindication for the vaccine.
One more question from the chat, and if anyone has any follow-up questions, please leave them below. But should we anticipate a continued ramp up of vaccine availability across the state, or should individuals focus on larger cities such as Dallas or Houston for access to vaccines if they are in a high-risk group?
Dr.
Yeah, go ahead.
Do you have an opinion on that, Doctor?
You know, the state, thus far, the allocations have been going to the state, and we were talking again before, or Dr. Schmalstig mentioned, a lot of those decisions are made down in Austin at the central office. But certainly, I know that's one of the discussions in terms of the distribution. And even nationally, there in the allocation, there are definitely urban areas and places that have been more hotspots than others. But then some of those allocation, it can't be that other places don't have any access. You know, and again, Dr. Schmalstig may want to chime in the discussions with the state. They weren't going to give all of the vaccine to just us in Dallas or something, even though we are one of the higher places. I think they had the need to also provide some to other places. But definitely the data are showing that it's in some areas where it is certainly much more transmission. And that was part of the federal initial allocation. It was New York, Chicago, and Los Angeles that got the bulk of those initial distributions, but they didn't only send it to them. I think they sent it to, that's how we got our first allocation, and we're glad we did. So again, it's from whatever person's perspective, I know we're all fighting for it and trying to get as much as we can, but when you don't get it, then you want some for your own. So.
Yes, Dr. Wong, if I could add that while the larger allocations were made based on the number of cases, regardless of which county you live in this region, there should be, you should be able to reach out to find out where to get vaccinated. Just find out where your local health department is. And if you don't have a local health department, please reach out to us in Region 2-3.
Yeah, and from Dallas County's perspective, if the state and the feds can get us the vaccine, we're happy to vaccinate people who may live in a surrounding county in the region, right? We recognize people might have an exposure in one county and live in another, and they might work in a third, and they might in turn, unfortunately, expose somebody in a fourth. So the key thing to winning for us is to get enough vaccine, and we'll be able to get that into people's arms and do the contact tracing so that we get it to the right people first, and then to as many people as we can that need it when we have it. But the key thing for us is just getting the vaccine.
And that was the last question from the audience. Councilmember Narvaez, if you want to say some closing words.
Thank you, Zanir, and thank you again to everybody out in the virtual universe who joined us tonight. This is a very important topic. We hope that we were able to answer as many of your questions as possible. And please feel free, if you didn't get your question answered or you want more information, feel free to, you can email me at my office, omar.narvaez, that's N-A-R-V like Victor, A-E-Z, at dallas.gov. And we will get that forwarded to whomever we do that we can in order to help get your question answered if we still need one. It's also important to know that the shots are free of charge. There's no charge for the shots if you get it through the county or through one of the affiliated folks like Parkland Hospital or one of the other affiliated organizations, as well as with testing if you go through one of those routes, which are the only routes at this point. We are working desperately, very hard as a county and as a city, working together with our state representatives, our county judge, and our medical professionals in order to get more vaccine into the county as quickly as we can. These shots are coming from the federal government. They're distributed based on the number of infections in each different part of the country. Please know that you have a team that is fighting for you and advocating for you so that we can keep our neighbors and our residents as safe and as quickly as we possibly can. Once again, my name is Omar Narvaez. I serve as the Deputy Mayor Pro Tem for the City of Dallas, as well as the chair of the City of Dallas's LGBTI Task Force. And I again want to thank our County Judge, Clay Jenkins, who has been instrumental in helping us, not just through COVID, but now as we go into hopefully getting monkeypox to almost nothing before it becomes something like a COVID. And last but not least, State Representative Jessica Gonzalez, thank you so much for your leadership and your advocacy, not just here in Dallas, but down in Austin on behalf of all of us. And to Dr. Roberto de la Cruz and Dr. Huang, thank you for your tireless work and advocacy. I was hoping that we would never have to join again on something like this after COVID, but here we are. And thank you all for stepping up to the task and being there with us. And also to Dr. Schmalsteig for joining us today out of Region 2-3. That was a nice surprise for us to be able to get somebody with the epidemiology background. Representative Gonzalez, I don't know if you want to say anything else, or if you're ready to let us go.
No, I just wanted to thank everyone, all the panelists, in providing this important information. I know that everyone here is working hard to make sure that folks are getting vaccinated, and we have people that are streaming in, listening from all over the place, not just here in Dallas, not just here in Texas. And so I want to just thank our panelists. I want to thank Univision for partnering with us on this event and translating this panel on their website into Spanish. I think it's important that everybody gets this information. And so again, thank you everyone for joining us on this panel, and thank you to the panelists again for providing us with this important information.